to teach you guys today is kind of basic, but it's something that we thought was applicable to everybody's everyday life. So we're going to talk about how you can calculate your caloric need, which we learned how to do it by hand, but with the app you can do just by plugging in some numbers. So how we learned to do it by hand, nutrition professionals use this equation called the Mifflin-St. Jean equation. And then these other two down at the bottom aren't really used very often, but sometimes they are. So this is the equation that we get to do by hand on some quizzes and exams, but most dietitians in the hospital will have like a computer program or something that will do this for them.
Yeah, so this is the app if everyone saw the little lady. So this does basically what we would do by hand. We have like a little worksheet too to pass out at the end. And we can go back and you guys can try it by hand if you want. But basically this will tell you how many calories that you needed or burned each day. And this app also tells you the activity factors. So let's say you work out 3 to 5 times a week, you'd be moderately active, and you would need a little bit more calories to keep yourself going. And this app requires that, so we decided this was the best one when we were looking some up because it tells you that there. So
Yeah, so your basal metabolic rate is the amount of calories your body needs to just be still and basically survive.
So we'll go ahead and pass this out before we go into this part of the slide. So the first thing that we're gonna do, a lot of our equations require kilograms and centimeters, but in America we use pounds and feet and inches. So we're gonna have you guys be able to convert between those two. So the first thing, you guys can use a random number if you want, or your own weight, doesn't matter. So if you start off with your weight in pounds and divide that by 2.2, you'll get your kilograms. You could just use your calculator on your phone, or just like pretend you're typing it in your phone. And then for your height, you have to do your total inches. So I'm 5'8", that would be 68 inches. So you have to do 68 inches times 2.54 to get your height in centimeters. And then if you guys want to try plugging that in on the app, you can put in your age, and your weight and your height on this screen, and then if you hit calculate BMR, it will read that out to you.
and the app, this app is nice too because you don't have to convert yourself to the kilograms or centimeters, but it's nice to learn how to do it by hand too,
So if you guys if you're at this screen, is everybody here now? You can calculate your BMR. It'll say your BMR at the top, so it'll say kcals per day, and that's if you were just sitting around doing nothing. But then it also brings in your activity factor, so if you get little to no exercise, it'll take that into account and bump it up a little bit just because you are going to be moving around some, but you can figure out how many calories you need per day based on your activity factor. But that's the pretty basic part where we start, and then off of that we do some other calculations. So the next step on that piece of paper is your AMDR, which stands for your acceptable macronutrient distribution range, and so this is figuring out how many carbs, fats, and proteins you need. So if you just take whatever this number spat out at you and you multiply it by these percentages, you get how much you should need for carbs, fats, and protein.
So what I usually do is, so protein, the minimum amount of protein you need is 0.8 grams of protein per kilograms body weight. But if you're working out, you probably need a little bit more. So if you can figure out how many grams that is, you can kind of start from there and then do the math from there.
And I guess this is kind of confusing on the sheet without explaining, but once you take that percentage of the AMDR and you multiply it by your total caloric needs and you get a calorie it'll be like a high number, maybe like 1,700 calories for carbs. You could divide that by 4 and get the amount of grams that you need per day, because there are 4 calories of carbs in a gram, or 4
4 calories in a gram.
yeah, 4 calories in a gram. And then fats is 9 calories in a gram, and then protein is the same as carbs, so 4 calories in a gram. So that's where you would get that number to divide by 4, divide by 9, divide by 4, to get how many you need per day, if that makes sense.
So we would figure out what percentage to use. Basically, it's unique for each person. So if someone is losing weight, we would bump up their protein past that 0.8 or 0.8 grams. So it just really depends. Or if someone like really loves carbohydrates, then we would kind of keep theirs on the high end and change the other ones.
Does anyone have any questions on how to do like this, the baseline calculations so far? Alright, so then we can adjust these based on different diseases. So for example, kidney disease, you have to watch the protein because your kidneys can't handle high amounts of protein if they're failing. So there's different protein ranges, and so we have to calculate different protein for people who have kidney failure.
But it does start to come up once the patient receives dialysis, because obviously it's getting filtered out of their kidney.
Okay, and then some other diseases that we would look out for as a dietitian would be diabetes, and that is where we would monitor the carbohydrate intake. And the Mediterranean diet is often used for heart disease or cardiovascular health because of the fat content. And the DASH diet, those with hypertension or high blood pressure typically watch sodium, so that diet's geared toward those that have issues with that. And then cystic fibrosis, increased energy needs, fat, and vitamin and mineral needs. So that's something that we would look at with patients.
And then like we said, most hospitals or there's like through the academy you can get have all of these equations on the computer for you, so you don't have to sit there and do it by hand if you didn't want to. So there's a lot of technology that we can use.
But we do not have those resources here used at OU.
Yeah.
We've been doing it all by hand, so we couldn't bring that part in.
Do you guys have any questions?
Is it me?
Yeah.
Does it matter what time of day you're getting, say, your protein or carbs, or is that important, or is that
You mean
just
night
like,
versus day?
yeah,
For example, like diabetics, it depends. You have to spread your carbs out. You can't eat that all morning, and
Mhm.
there is a hormonal flux versus the morning and the night.
okay,
So you want to eat a protein-heavy breakfast for people who have diabetes. It's very specific to whatever disease they have.
So there's like a lot of different
It depends.
things. So like a lot of people will have like post-workout you want to refuel with protein and carbohydrates, but like pre-workout you want to do mostly like just carbohydrates. So it's like different things like that. It depends what you're doing, or like what disease state you're in, or if you're trying to lose weight or stuff like that.
okay. Thank you.
Would you guys do you ever recommend the paleo diet? Do you have I've always heard some different things about it, and it gets contested all over the place, but
It's not something we learn about in class. It's not a method we use to treat any diseases for like medical nutrition therapy. But if a diet works for somebody and they feel like that aligns well with their values, then by all means, that is something that they can go for.
Yeah.
So if they think the paleo diet is a healthful, balanced diet, and they're trying to get a very varied, healthful, and moderate diet is normally the words we hear, then yeah, could be recommended.
Yeah, I would say it's definitely person dependent, you know, like Jenna said, if it works for you, it works for you, but that might not work for someone else, so.
And it's like, so a doctor will often recommend something like the DASH diet or the Mediterranean diet, but I would not think that a doctor would be like, oh, you should go to the paleo diet, because that doesn't really have research backing it, I don't think, but the DASH diet and the Mediterranean diet do.
Those are the two main ones that we, and DASH stands for Dietary Approaches to Stop Hypertension.
Oh.
And Mediterranean is just,
Like-
high
Obeying the
in,
Mediterranean.
Yeah,
What'd you say?
Exactly.
Obeying the Mediterranean.
yeah, so like high in unsaturated fats.
Yeah, like healthy fats and olives and avocados and things like that. Any other questions?
I have a question for you. So with nutrition, I feel like that's one of the things that like, cause there's emotion tied in with food a lot of times. And that nutrition is one of the things that you guys have like to worry about the patients being compliant the most. And so that can be kind of frustrating. How do you guys deal with that?
We definitely we take 2 counseling classes, but by all means, that doesn't make me an expert counselor or anything, but it's not like I'm gonna be like, oh, you're lying, but I definitely wanna be supporting and, I don't know, just checking in with them and just giving them recommendations I think that they can actually follow. Like, it's not like I'm going to recommend someone start running 3 miles every day if they are usually watching TV all day. So it's just kind of making realistic goals and things like that.
I feel like it's very client-centered as well. So if a patient doesn't want to do something, they're not going to, but it's not your job to, follow them around if it's an outpatient facility. So you can, like Ashley said, only give them recommendations and hope that they follow them, and if they don't, I don't know what you would do in that situation other than, try to work with them and do what works best for them.
It's definitely the biggest issue, I think, because people are brought to you under circumstances where they've been referred to you, and it's a life-threatening issue most of the time, especially an inpatient. They might not necessarily want to change their lifestyle because it's not something that really sees immediate effects, so.
Yeah, especially in the hospital, a lot of people don't even want to talk to you. They just kind of are like, I don't care, like, I just had a heart attack and I don't care about this. So it just really depends on the person.
I had a question about children again. Working with children, so you find kids aren't, going to be preparing their own meals, so then I'm guessing you have to work with the families. So I just wondered, is that something that's covered, or is that kind of a specialty, or how do you do that?
You mean,
Pediatric?
like, classes specifically? We don't have a pediatric class.
Yeah, I would say I worked with Live Healthy before, and their goal, if I were to work with kids, is to, you're not going to be able to get all the veggies at once or all the fruits at once. So even if you bought, one thing at the store that was healthy, that's the goal. I would say, and it's not our goal to judge them either. So
Right.
if you're going and you're like, hot dogs are bad for you, that might be all they eat. So it's less, you can try to get that to go down, but more about incorporating healthy things every now and then. I would say for kids is
Okay.
what I gathered from that.
I haven't worked at Children's Hospital or anything like that, or had any hospital visits with children, but I've only worked with Live Healthy kids, which wasn't like a clinical setting.
Yeah.
But we do send home recipes and with the parents, and we're always like, if you like this recipe, be sure to ask your parents if you can make it at home and things like that. So
Yeah, my kids really like the program.
awesome.
Any other questions?
Thanks, guys.
All right.